slow. Now we're good. So thank you. Okay, so again, thanks with OMAFRA joining us. And again, obviously with Christina, with her expertise here, we appreciate your help as well. Christina, you've gone through some of the housekeeping details with that. And most of us that I've seen, I think have been on before. So we're gonna kind of fly through those. We are pleased to have Rick Bethune with us here this evening. We have Tim here, the manager, COVID analyst and policy unit with COVID, agri-food secretariat, Ron Laundrie here, the senior manager with the provincial industry health, safety, industrial health and safety programs with the Ministry of Labor, and Christine Wager, the senior policy advisor. Welcome, and I'm not going to add any further comments really, other than that I welcome OMAFRA here this evening and your team here to take part. So I'm going to turn it over to Rick, and for the next little while it will be you and your team presenting some information, and as Christine said, that she is going to work with us in monitoring any questions that come through the chat, and we'll be able to try and answer those questions. We did ask for information ahead of time for that, so hopefully it's going to run very smoothly. So with no further ado, welcome, Rick.
Thanks, and good evening, everyone. And I want to start by saying a big thank you to Vince. He's been a strong advocate on behalf of the association, representing all of the societies across the province. And we've been in constant dialogue with him over the last several months in regards to understanding some of the complications that societies have, as well as seeking advice for ourselves and for senior leaders inside of our ministry to understand how it is that we can possibly be assisting. So tonight we've got a few people that are here from the OPS, representatives from OMAFRA, along with our colleague from the Ministry of Labor, Training and Skills Development. We've got two formal presentations that we're going to go through, and really we want this to be a conversation. It's really to talk about step 2 in Ontario's reopening plan and how it pertains to agricultural societies. And glad that we're going to try and control the questions through the chat. That is great, because with a large group, it could be, we could see lots of questions, and we do have some questions that have been submitted in advance as well. So I'm going to turn it over to Tim Metzger, who's with our COVID Secretariat inside the ministry, and he's going to walk through the first presentation. So Tim, wherever you are out there.
I will, and sorry, as I work off two screens, you can see the side of my head for a little bit.
And I have to tell you that Tim's an avid Habs fan, and he knows there's an important hockey game tonight.
That is true. So if somewhere around 8:17, which seems to be about puck drop, I start to look sideways, is because I would be admitting to multitasking. Let me try this again.
We can see something on the screen.
I know, but it didn't do it the way I wanted it to. So let me try this again.
Not the way we practice that, Tim.
It's not the way we practice it, I know.
That's looking good. Not quite.
There we go.
There you go.
There we are.
Okay, so yeah, thanks for the invite, and appreciate all the interest in the session tonight. We did see quite a number of the questions that came up, and I'm going to be quite frank and open up front that some of the nuances of some of the specifics we may not be in a position to necessarily talk through tonight. In the agenda that was sent along with tonight, there are a couple of links in there. One is directly to the regulations, which are sort of the governing force behind the requirements. And then there's another link into the public health measures that sort of govern through the regulations, and they're a little bit more of a plain language, I would say, summary of the requirements. And I would really encourage everybody to take a look at those two. And then I guess the other caveat right up the front is with everybody's plans for operations, you do need to have a safety plan, and certainly the local public health unit will be the one that needs to be worked with in any cases of working through the nuances of your individual event or individual facilities. As mentioned, this is step 2. The province is announced quite a little while ago a 3-step framework to sort of working our way through COVID following the last shutdown. Most of the province, with the exception of my local public health unit, moved from step 1 into step 2 last week. And all the indications, or I guess what's been announced, is the province will stay in each step of the framework for approximately 21 days, which would say about 2 weeks from now, we could be entering into step 3. Of course, that's all predicated on the vaccination rates, both single rate and double vaccination rate, and some other public health indicators, which again, as personally I've seen, can affect each individual public health unit working through the framework at a different pace. And certainly within step 2, I know a lot of folks are anxious on step 3, and I think the only message I have is hopefully those requirements will be released fairly shortly, and I'm not in the position to really speculate about anything that's in there other than what you can find on the ontario.ca/COVID website that does talk about step 3 getting into a little bit more indoor activities and some larger events. But certainly if folks found this session or find this session helpful, we are more than willing to come back at whatever time in the near future and sort of run through the same piece on step 3. So generally within the province, and specifically things that go to fairs, rural exhibitions and festivals, very similar requirements to other large events and parks and whatnot, but outdoor attractions are open. And then indoor attractions and indoor events are very, very limited. There are a couple of exceptions. So if there needs to be access to washrooms, some retail sales, or some health and safety supports, then things can be open. But certainly dining and it needs to be outdoors, and any events need to be held outdoors at this point. As I mentioned, safety plan is required, and you can see at the bottom of the screen what all needs to be in there. And again, that's just a summary. Take a look at the websites to really develop what you need to do. So within that capacity, it is 25% of the outdoor areas of the facility. And I think Vince, when we were chatting a little while ago, talked about some tools that might be available for folks to be able to help do that calculation, that for your own individual operation. And then within that, if there are events within the event, so if there's a smaller exhibition within, say, a fair, the capacity within that is also 25% of whatever that facility's capacity would be as well. Seating events, again, outdoors, limited to 25%. And one of the things that I know I saw a couple of questions on already is reservations are required for seated events. That's, I guess, universal for all seated events, regardless of who puts them on. And I would say that the regulation is very flexible, or the regulation says there needs to be reservations. How an individual event determines what reservations consist of, I would say would be pretty flexible to achieve that outcome. So again, I saw in the questions a couple of things about um, people coming and reserving a spot, or getting a little ticket to come back at a certain time. And again, I'm not here to sort of say how reservations can be done, other than the fact that the regulation just says they need to be, and you guys can figure out what works best for your place. So if we do get into fairs that do have midways, as long as they're outdoors, that is a part of it, similar to amusement parks and other places. Again, 2-meter distancing, face coverings, and then generally when people are in the broader event and they're outdoors, there's advice to wear face coverings, but not necessarily a hard requirement. But indoors at any time, similar to grocery stores or retail, anything would be face covering required. And then again, within the outdoor setting, physical distancing is always advised for people that aren't in a family group or a cohort. And then on the screening of patrons, passive screening. So if folks have walked into retail establishments, you'll see some of the signs posted on passive screening, and that would be applicable for that. But certainly any performers or employees, if you have entertainment or whatnot, there is active screening required there. So real quick run through again. I know I'm not going to be able to cover every question that may sort of pop up as we go through, but certainly advise everybody to take a look at both the regulations and the public health guidelines, which do run through a little bit more specific. And that's kind of it in a high level. And again, certainly know that there's interest in seeing what step 3 will look like, and hopefully we get there pretty soon, and hopefully we get an announcement on that. But something that I don't have any direct insight into.
Thank you, Tim.
I'm just, I'm not sure if we're going to want to, manage the questions, Christina, and ask those at the end, or if I know there was a few questions that popped in there, or if we want to address them as we go through.
It's entirely up to you guys. If we want to take a pause with these questions and then continue, we can do that, or we can wait.
Why don't we take the few questions that I see in there now, and I don't know if you want to read those out, Christina, if you've got them.
Yeah, no problem. So the first one we have is, how is the maximum capacity determined for the fairgrounds or for grounds?
Yeah, and sorry, I'm just making sure I didn't mute myself there a minute ago. But yeah, certainly it's basically there's a calculation which again on that public health guidelines, it essentially takes the total square meters of a space available to the public and divided by I forget the actual number for 25, 50 or whatever percent, but yeah, I think that's outlined quite nicely on there, and I'm just trying to find it so I can read it.
Actually, to save you some trouble, Christine typed it in the chat box.
Perfect.
So I can read that out. So
thank you, Christine.
She said the number of members of the public in the outdoor area of the facility where the outdoor event takes place at any one time must not exceed 25%, determined by taking the total square meters of the outdoor area accessible to the public at the facility, dividing that number by 16 and rounding the result down to the nearest whole number. So 16, that's the magic number.
16, that's the number.
Great. Okay, the next question I have for you is, what if there is no formal outside seating?
Yeah, and I think if there's no outside seating, again, that reservations are required for seating, and if it's an event within the event that doesn't have formal seating, then it would be the 25% of whatever the maximum capacity of that area is.
Perfect. And no reservations would be required in that situation?
If there's not seating, no.
Okay.
Not, again, to my understanding.
Great. Then I have Leah asked, will your safety plan need to be approved by local public health?
I think I'm not aware of an actual requirement. I think certainly for any events, there's a benefit to engaging a public health unit. I know I hesitate to say phone your public health unit with 100 questions, because I know they're busy trying to do things like vaccinations, but there's certainly a safety plan is required. Again, the requirements are on the website, and if appropriate, engagement with the local public health unit is probably wise.
Fair enough. All right. Well, that's all we had related to that first section. Hold on, though. One more came in, and then I will say we'll save the rest of the questions for the end, even if more come up. So Joyce asks, well, bleachers, is that considered public seating that requires reservations? And I'm guessing, Joyce, you're thinking more temporary bleachers, right? Rentals?
Yeah, and that's, I guess the regulations basically say that if there's seating at an event, it requires reservations, and yeah, that's kind of where I would think I would go with that.
If you can put your butt down, then it needs a reservation. All right, perfect. Well, I'll let you guys continue on. And like I said, I'll keep track of the questions as they come through and bring them up at the end.
Perfect. And I see a couple more popping in, but I'll turn it over to Ron, Ron here now, and see if he has the same better success with sharing a screen on the first try than I did.
All right, thanks, Tim. I'm just going to bring up the presentation. Okay, so it should be full screen for everyone. All right, so I'll get started. Yeah, so my name is Ron Landry. I've been with the Ministry of Labor Training and Skills Development since 2004. I began as an inspector in the Industrial Health and Safety Program in what was then called the High Risk Initiative. I've had roles with the ministry, including regional program coordinator, regional manager, policy advisor, provincial specialist, and now as a senior manager heading up the Industrial Health and Safety Program. Before working for the ministry, I worked 15 years in the automotive manufacturing sector. So enough about me. I'm going to get on the presentation. So I'm going to be going through some information, what you need to know about the Ministry of Labor Training and Skills Development and preventing COVID-19 in your workplace. And get to the next slide. So some of the things I'm going to be covering today, an overview of responsibilities of the various workplace parties. I'm going to cover some areas where, why you may see one of our inspectors come to your workplace or event, the different types of field visits that we do, what to expect during a typical field visit, some frequently asked questions, and as well providing some resource information. A copy of this presentation will be made available because there are some very good links throughout the presentation. And of course, what would a presentation be without a disclaimer? So essentially, what I'm telling you today, none of it's legal advice. If you want legal advice, you should seek legal counsel. And this presentation has no bearing on the efforts of our inspectors in the field. They enforce the Act and its regulations based on the circumstances observed at the time of the field visit. So let's get started. So the Act came into force October 1st, 1979. And the main purpose of the Act is to protect worker health and safety. And it applies to all workplaces in Ontario, except for federally regulated workplaces such as banks and post offices. And it also does not apply to work in the private home carried out by an owner, occupant, or servant. So the Act contains the workers' rights, and there are the 3 rights and responsibilities. Workers have the right to know about any hazards to which they may be exposed, and the employer must provide training, instruction, and supervision about the health and safety hazards in the workplace. Employers must ensure that workers understand the safe work procedures, and workers are encouraged to ask questions about hazards in the workplace. Workers participate in identifying and resolving health and safety concerns. They also have the right to refuse unsafe work without fear of reprisal. And of course, workers have responsibilities as well. They're required to work in compliance with the Occupational Health and Safety Act and its regulations. And this includes following the safe work procedures and the requirements of the employer's health and safety policy. And if a worker sees anything that looks unsafe, they should tell the supervisor or employer right away. The worker may also speak to a health and safety representative or a member of the Joint Health and Safety Committee. And if a worker becomes ill due to COVID or experiences any symptoms, the worker should report it to a supervisor immediately. So under Section 50 of the Act, employers are not allowed to reprise against or punish a worker for obeying the law or exercising their rights. So the employer cannot dismiss or threaten to dismiss a worker, discipline or suspend a worker or threaten to do so, impose or threaten to impose any penalty upon a worker, intimidate or coerce a worker for following the Occupational Health and Safety Act and its regulations. And if a worker feels they've been reprised against, they can call our contact center to report it or send in an email to the WebOSH address provided on this slide. So it's important to note the role of an inspector in a reprisal complaint is not to determine whether or not the individual was reprised against. The inspector will follow up on any health and safety related concerns that were part of the reprisal. Whether or not the worker was actually reprised against would be a decision of the Ontario Labour Relations Board, which is an arm's length division of the ministry. And they have the power to order remedial action should they determine after the course of an investigation that a worker was in fact reprised against. And if the worker wishes to pursue that avenue, then the inspector can help provide contact information for the OLRB to advance their concern. So employer responsibilities under the Occupational Health and Safety Act regulations, employers have the greatest burden of responsibility to protect workers from hazards in the workplace, including infectious disease. So some of the key employer duties are to take every precaution reasonable in the circumstance for the protection of a worker. So specific to COVID-19, for example, a lot of the orders that we have written in regards to COVID-19 apply to the hierarchy of controls and the various levels of cleaning, screening, things of that nature that have to go into the precautions to prevent COVID from entering the workplace. So you'll know into the Act, there's no specific reference to these types of things. So it comes under the general duty clause of taking every precaution reasonable in the circumstance for the protection of a worker. So employers also have the duty to provide, maintain, and ensure proper use of equipment, materials, and protective devices. They have to ensure required measures and procedures are carried out. They have to provide information, instruction, and supervision to workers. And they have to acquaint workers and supervisors with all workplace hazards. So on the topic of health and safety representatives and joint health and safety committees, these are all based on the number of workers regularly employed. So, for example, a lot of these events are very short term, where you may have a lot of workers, but it's for a very short period of time. No different than some of the seasonal workplaces that are out there. So what we consider regularly employed is over a 3-month average in making that determination. So in workplaces where they're between 6 and 19.
Ron, can I interject for 1 second there?
Yes.
There was an important question. It's Rick Berthium here. Sorry. There was an important question about whether volunteers are considered workers. And I think that might be something we should probably address to the group.
Sure. So the workplace, a worker is defined, and it's receiving monetary compensation for services rendered. So if they're not being paid, they're not workers unless they're in some sort of a co-op program. If you look at the actual worker definition, there is some nuances, but the straightforward answer is if you're not getting paid, you're not a worker, which covers 99.9% of the circumstances. Now, if you don't have to be paid a lot, you could be receiving an honorarium, right? If you're getting any sort of a pay, whether it's $15 an hour or $1 an hour, you're a worker, right? So they're in the count for workers. Does that answer the question?
I think so, yes.
Okay. All right. So the Joint Health and Safety Committee, so between 6 and 19, you need to have a health and safety representative. And there is no mandatory training for that individual. There is free training available through our health and safety associations, should you choose to participate in that. And if there is at least 20 regularly employed workers, the employer must set up a joint health and safety committee, half of which must comprise of worker representatives selected by workers. And you need to have certified members on that committee, and there is mandatory training for certified members. There's a Part 1 certification, which is the same information all certified members get. Part 2 is modules specific to the type of hazards in your particular workplace or circumstance. So the key functions and powers of these committees, so both Health and Safety Committee and Health and Safety Rep, inspect the workplace at least once per month, identify workplace hazards and make recommendations to the employer, obtain information from the employer regarding identification of hazards. They inspect the workplace and investigate following critical injuries, fatalities, or work refusals. And they also have the opportunity to accompany a Ministry of Labor Training and Skills Development inspector during inspections of the workplace, if they are available. You know, there are times where we arrive at a workplace and the Health and Safety Rep or Joint Health and Safety Rep is not present, so the inspection continues. But if they are available, they can participate. And additional responsibilities unique to the Joint Health and Safety Committee is a committee meets at least once every 3 months. They keep minutes of their meetings. And certified Joint Health and Safety Committee members may initiate bilateral or unilateral work stoppages if they believe that dangerous circumstances exist. So, you know, many folks are familiar with a work refusal and the terminology around that in the process. It may not be as familiar with bilateral or unilateral work stoppages. So these are where a certified member can initiate a work stoppage without the involvement of a worker if they believe that dangerous circumstance exists. It's always been on the books. It's nothing new. They've always had this power. Prior to the pandemic, I would say in the average year in the province, seldom if ever used. But it is on the books. Good to be aware of. So what are some of the reasons that the Ministry of Labor Training and Skills Development may come to your workplace? So basically we have two sides. We have an inspection side and we have an investigation side. So basically proactive and reactive circumstances where we will go out to the workplace. It's the same inspector regardless. Our same inspectors do investigations and inspections. So on the proactive side, we have initiatives and campaigns and blitzes focusing on known industry hazards. So particular initiatives and blitzes, we'll have a whole campaign where we announce, you know, well in advance what sort of things we're looking for, all sorts of resources to assist folks in supporting their term responsibility and raise awareness of these hazards. So it's not a sneak up and gotcha situation. It's these are the hazards we're looking at, and in this 2-month period, for example, here's great information resources to help you get prepared. And ideally, when we get out there, you know, everything's in place and we've raised the awareness and raised the bar, and we carry on. On the investigation side, these are reactive calls. So this is in response to critical injury or non-critical injury reports, complaints that we receive. You know, some folks think that you have to work there to call in the complaint. Anybody can call in a complaint. You don't have to be a worker. You could be a customer in a store and you see someone doing something unsafe, let us know. Work refusals, when they're reported to us, reports of occupational illnesses, as well as referrals from other agencies. So those are just some of the various reasons why we may arrive at your workplace. So the inspectors have numerous powers. I'm just going to run through a few of them here. So the power of entry. So by law, if an inspector shows up, you're required to permit them to enter the workplace for the purpose of their inspection or investigation. You know, we don't knock down doors, right? We arrive, we introduce ourselves, identify ourselves, explain our mandate, why we're there, and then go about our business. The inspectors also investigate any potential hazardous situations or work refusals, complaints, injuries, illnesses, or fatalities. And they can order compliance with the Act and regulations. They also can commence a prosecution when warranted. They can question any person, this is under 54(1)H, and they can handle user tests any equipment, machinery, material, or agent in the workplace, and they can take away any samples. Again, this is under 54(1)B and E. They also can look at any documents or records, take them from the workplace in order to make copies, and also take photographs. And on the Occupational Health and Safety Act, there are penalties for non-compliance. An individual can be fined up to $100,000 or up to a year in prison or both. And a corporation found guilty of an offense is liable to a fine of up to $1.5 million. So those are the maximum fines as stipulated in the legislation. So part of an inspection process, the typical inspection process, usually starts off with administrative review before you actually get to physically walking through the workplace. So some of the things that the inspector may look for is to ensure that a copy of the act is posted, that you have a health and safety policy that's posted in writing, it's reviewed annually, it's signed by a senior manager or owner. They have a workplace violence policy and that's posted, and they may possibly review the program. They have a workplace harassment policy and it's posted. And then you have the health and safety at work poster posted in the workplace. Continuing with the administrative, looking at the internal responsibility system. Requirements for joint health and safety committee or health and safety representative. If you have a GHSC, do you have your certified members? Again, with the GHSC, looking at minutes of the last meeting, myself personally as an inspector, I'd always look at the last three because I want to see if issues are being identified and if issues are being addressed, right? If the same issue is being identified for the last three meetings and not being addressed, then the committee is not really functioning properly. There's something wrong there, right? Something is not being addressed. Looking at recommendations to the employer and what the responses are, and again, any issues. And workplace inspections that they're being conducted on a regular basis. So then we get to the physical inspection of the workplace, the actual walkthrough. So accompanied by a representative of the employer and a worker health and safety representative if there's one available. But either way, we're accompanied. We don't just wander through your workplace on our own. That's our inspectors are workers as well, and we need to ensure their safety, so they're always accompanied. So they'll review the work environment, look at the machinery and equipment that's in use, things like lighting, operating conditions, indoors, outdoors, worker exposure to hazards. Is there lockout, tagout procedures in place? Are machines guarded? Is personal protective equipment being used and being used properly? And is it appropriate to that circumstance? What sort of chemicals are in use? And does everyone understand, how to protect themselves when using that chemical? And what to do if something goes wrong, if there's a spill, what do you do? Right? These are all part of your training to work with things safely. Also looking at training on equipment, operation of equipment, identification of hazards, and again, personal protective equipment. So continuing with the inspection, we can also look at specific to COVID, masking requirements, for staff, source control, and as required, personal protective equipment. Eye protection also required if with the worker is within 2 meters of another person and not protected by a barrier. And if there's an active outbreak, masking and eye protection at all times may be a reasonable precaution based on the type or circumstance of the workplace. Looking at protection barriers for workers in specific settings, such as kitchens and reception areas. So, for example, you may have a kitchen layout where maybe the way it's laid out and everyone's in their station, everyone's 2 meters apart, and you might think, okay, we're good, right? But you got to consider that people are not going to stay in those settings, right? They're going to go to get more supplies. They're going to take food up to the counter. This, it's a crossover. You need to consider the wholesome approach and make sure that you're protecting workers. Physical distancing requirements, including visual cues, and consider how this will be, physical distancing will be managed during breaks and lunches. One thing we found through the pandemic is that breaks and lunches, even in safety plans, breaks and lunches may not have been looked at as closely as perhaps they should have, and they did become a vector for spread for some time. So we have raised awareness on breaks and lunches. Also cleaning and disinfecting, including women's hazards. Chances are you're using cleaners in your workplace that perhaps you never used before, right? So you will need to make sure that workers are working with it safely. Workers and supervisors have their occupational health and safety awareness and training under Reg 297. Also screening requirements. So staff screening, passive screening of patrons and guests, and signage to help support that. So anytime we visit a workplace, there's a field visit report that's left with the workplace parties. So the field visit will identify who participated in the inspection. It's signed by the workplace parties, so both worker and management. And it will contain any orders. So orders are, have to do items, right? If it's not an order, we're sharing information, maybe some resources in the detailed narrative portion of the field visit to help you support compliance in your responsibility system. So there's different types of orders. There's a time-based, so it needs to be complied with by a set date. Plan order, which may be a more complex matter, perhaps assessing a hazard and coming up with a training plan for your workers, in which case, you put together a plan, goes to the inspector, and if it's acceptable, then it's replaced by a time order based on your plan. Forthwith order would be something that was corrected at the time of the inspection. So for example, maybe an emergency exit was blocked with a couple of boxes, and the inspector said that's a problem that needs to be addressed. And so right away, they send someone over, they clear that. That would be a forthwith order. And stop work orders, which are imminent hazards to the worker, for example, an unguarded piece of equipment, where the inspector would issue a stop work order. So you have to stop use of that piece of equipment. And even when it is guarded, you still cannot use it until the inspector comes back, re-inspects, and lifts that stop work order, and then it can go back into use. So the narrative portion of the field visit, again, separate from the orders, it'll identify the reason for the visit, areas that were looked at and reviewed, and this is where we can provide some additional resource information, web links, things of that nature, to assist workplace parties in achieving compliance. And then if there is any orders issued, there's a second document, which is a notice of compliance form. And that's how you let the ministry know that you've complied with the orders. So it's a document that's signed off by a worker member and management saying that they've complied with, order number 1 or 2, whatever order it is. And that's sent to the inspector, typically by email these days, to confirm that the compliance has been achieved. And the inspector can follow up with the workplace parties, by calling or by physically attending the workplace as need be given the particular circumstance. So who's responsible for protecting workers from hazards, including COVID in the workplace? Well, the greatest responsibility is on the employer, but really at the end of the day, all workplace parties have a responsibility for promoting health and safety in the workplace, to help the workplace comply with the act and to prevent the spread of COVID-19. So everybody owns a piece of it, right? The employer, the supervisor, the worker, all working together in a properly functioning internal responsibility system. It actually provides the single greatest protection for worker health and safety, more so than even an inspector attending the workplace. What I mean by that is, if an inspector attends, finds a contravention, they'll write an order, and compliance with that order is to the minimum standard as prescribed, right? That same hazard, for example, could be identified by the Joint Health and Safety Committee, and they could make a recommendation to the employer that exceeds the minimum standard. And if everyone agrees, then you move to that higher standard. So we can't order that higher standard, but obviously we fully support and encourage you going to that higher standard. But that's the key here. The key is your internal responsibility system, everyone participating, no one fearing reprisal, just speaking freely and moving to the greatest level of worker protection. So what COVID-related legislation might apply in my particular workplace? So the rules for outdoor affairs and rural exhibitions can be found through the link provided. And special requirements for attendees live entertainment, livestock shows, demolition derbies, midways, and garden tours can be found under the 2 schedule links provided in this slide. So how can you prepare to be COVID safe in your workplace? So developing the safety plan, as mentioned earlier. So to help business understand how to use the health and safety guidance to develop a safety plan for their unique situation, we have developed a toolkit that includes a guide, template, and checklist. The ministry has the COVID safety plan template, which you can use to develop your safety plan. It's not mandatory to use this template, but if you're looking for some help, you may find this useful to get yours going, or even maybe you want it just to compare to the safety plan that you have in place, just to make sure that you've ticked every box, that you've covered everything. This may be a useful document for you. We also have released over 200 sector-specific guidance resources for employers to help them prevent COVID in the workplace. Again, they are available through the link provided. There's also a free webinar and other tools available at Ontario Safe and Open, Building Your Safety Plan. So resources that can be used as part of the COVID safety plan. So it's important to note, as I mentioned earlier, you will be getting a copy of this presentation, but this is all point in time information, right? This is where we are, where we're at here and now today. 2 months from now, we could be in a different scenario, different precautions, different requirements. So it's always good to keep in touch. So the current state in the province, you can go to the Ontario Alert site or the Ontario Coronavirus site. You have the Stop the Spread business information line provided, and there's some resources available. So workplace screening tools for both worker and customer, cleaning and disinfecting for public settings. As I mentioned earlier, the break periods, make sure we're covering those. There's a break poster and lunch poster, as well as guidance on self-isolation and return to work. So what else to consider in the workplace? So implementing COVID protection should not create new hazards in the workplace. So it's an important thing to keep in mind. You know, you want to make sure that you're protecting your workers, but you also want to make sure they're not creating new hazards in your efforts to take those precautions. Also looking at mental health in the workplace. You know, there's a thing, mentalhealth.ca, which helps employers prevent work-related psychological injuries. And Resilient Me, which is a free program. It's self-guided that focuses on increasing the capacity for resilience. You know, we can only participate in the workplace and function as well as we take care of ourselves mentally and physically, right? So these are some great resources. Make sure the workplace violence harassment policy and programs are in place. Consider heat stress, right? A lot of these events, you know, particularly this group, are going to be outside, you know, and so you need to consider heat stress. Again, a lot of information available on websites, signs, symptoms, recognition of it, and steps that you can take to help protect yourself. And people vaccinated should respect the same workplace rules against COVID-19 as they did before. So again, this is point in time information. So as it stands here and now today, whether you are vaccinated, 1 shot, 2 shot, or no shot at all, same precautions are in place for everyone, right? So it doesn't change anything as it stands today. And there's also infection prevention and control at work basic awareness training, which is now available through PSHSA, and the link available there for some infection control information. So what if a worker tests positive for COVID? So under the Act 52.2, an employer is required to notify the ministry in writing within 4 days if a worker has an occupational illness due to an exposure at the workplace, or that a claim for occupational illness has been filed with WSIB. And the written notice should include information about the business, the worker illness, steps taken to prevent further illnesses, and you know, you can email that address or email that information to us through the MLTSD OC illness address provided. An employee who has tested positive for COVID should not return to work until they are advised by public health, and the employer must inform their workers that the exposure has taken place. So it's important to note that, you know, when you're notifying the other workers that an exposure has taken place or a potential exposure has taken place in the workplace, that you respect the privacy of the individual. So typically it would be like, you know, Tuesday around 2 p.m. on line A, somebody in that area tested positive. This way folks have the opportunity to get tested and prevent the spread in the workplace further. But the key is you have to respect that individual's privacy. So can a worker refuse to work if they feel unsafe due to COVID? So the worker has the right to refuse work that they believe will endanger their health and safety. So the worker must immediately report the circumstances of work refusal to their employer or supervisor. And when a worker refuses to work, employers are required to conduct an investigation and try to resolve the issue internally. And their process is outlined in Section 43 of the Act that outline the various responsibilities. It's only if the issue cannot be resolved by the workplace parties that the employer, supervisor, worker, health and safety rep, or joint health and safety committee member may then call the ministry's health and safety contact center and ask to have an inspector sent to the workplace to investigate. So can an employer make workers wear protective equipment? So under the Occupational Health and Safety Act, duties of worker 28(1)(b), a worker shall use or wear the equipment, protective devices, or clothing that the worker's employer requires to be worn. So yes, they have to wear the safety equipment required by their employer. Now the key is with the safety equipment is that you have to consider the hierarchy of controls, right? Putting personal protective equipment on a worker is your last line of defense. So you go through the hierarchy of controls, and this isn't just for COVID, this is for any workplace hazards. So first would be looking at engineering controls, right? Is there a way, physical barriers, ventilation, whatever, that physically prevents that from getting to the worker, whatever that particular hazard is. Administrative controls, so these are your policies, your procedures to try and protect the workers. If you've gone through those steps and you still have the hazard to the worker, then you're into personal protective equipment. So protect against COVID in non-healthcare workplaces. PPE for workers likely includes a surgical or procedure mask in addition to eye protection. And if workers are required to wear personal protective equipment, workers must be trained in its use, including, how to put it on properly, how to remove it properly, care and limitations, because otherwise it's a false sense of security, right? So they need to know how to use it properly to protect their health and safety. So we have a current proactive enforcement campaigns. So we have essentially 3 different teams that have been working throughout the pandemic. So the first one is our occupational health and safety inspectors, which is our normal core business, going out there focusing on workplaces with reports of outbreaks, particular focus on manufacturing, warehousing, distribution centers, food processing, and construction projects. And then we have the compliance assistance team, which is focusing on publicly accessible workplaces deemed essential, like grocery stores, construction projects, front offices of manufacturing, warehousing, food processing, and distribution centers. And then our multi-ministry team, which are doing local targeted COVID-19 safety campaigns focusing on publicly accessible workplaces deemed essential and workplaces that have heightened risks as identified by our local public health units. So these are some of these weekend initiatives that you hear about. They were out in the Niagara area last weekend. So these are doing various targeted campaigns using the local public health unit information to make sure that they're getting where they are best used in providing resources to workplace parties to ensure compliance. So COVID by the numbers, these are as of June. So we've had 85,000 public inquiries, 9,500 occupational health and safety calls, 8,500 WebOsh inquiries, 3,900 occupational health and safety emails, almost 65,000 employment standard calls, and 2,645 WebEx inquiries. So on the enforcement side, we've had 28,672 events, conducted 56,257 field visits, and issued 62,950 orders. However, our events in 2019 were 23,546. As you can see, significantly jumped up in 2020 with the pandemic, 31,003, and 12,295 at this point in 21. So we have 460 officers across the OPS, joining multi-ministry teams, conducting 14,309 workplace visits with the lens on promoting health and safety in the workplace in compliance with the Reopening Ontario Act. As mentioned before, over 200 guidance materials developed by our Health and Safety Association partners as resources for employers. We've also conducted, well over 100 webinars at this point to promoting employment standards and occupational health and safety requirements, touching on over 2,400 small business employers and vulnerable workers across the province. We've also contracted TSSA staff, and they've conducted over 11,000 workplace visits regarding the ECMPA and ROA and sharing resource information with the workplace parties. So some farming sector activities from January through to July 6, 458 field visits to 400 different workplaces, 236 orders issued, 9 tickets, and a total of 115 COVID orders. So the typical orders, as you see to the right, physical distancing, masks, screening measures, information instruction, and then disinfecting and cleaning. So initial initiatives have resulted in 400 workplace visits and roughly 19,562 workers impacted. So great outreach. And sector service data trends, you can see as we progress through the years. So, you look at 2000 field visits, 748 in 2019 to 1,326 in 2020. So you'll see the jump from 19 to 20 in the number of field visits getting out there, particularly in the farming and ag services and the temporary foreign agriculture workers. It's been a huge focus for the ministry. So we also have our contact center, which you can call anytime to report critical injuries, fatalities, or work refusals. You can also call anytime from 8:30 to 5 Monday to Friday for general inquiries, including questions about COVID. It is a toll-free number. You can also email your questions to the WebOsh address provided, and you'll get a response within 5 business days. And of course, an emergency situation, always call 911. That brings me to the end of the formal presentation. I will stop sharing and I can take any questions that folks have.
Fantastic. Thank you so much for that. I think what I'm going to do is I'm going to go through the questions chronologically. So we'll probably jump a bit between yourself and Tim, just to make sure we don't miss anything.
Sure.
There were quite a few coming through.
Yep.
Tim, you're not allowed to pay attention to the game yet. I know it hasn't.
We got a little bit of time till puck drop. I don't need to see the anthems.
Perfect. All right. So Harley asked earlier on, does the square meter occupied by the midway rides need to be included or excluded from the occupancy?
Yeah, and I think like the regulation states that the calculation is based on area that's available to the public. So if you've got a ride on the midway and that midway is not available to the public because it's not safe for them to walk there, again, I don't want to run the risk of interpreting too much on the reg, but I think if it's not accessible to the public, it would not be part. And then while people are on that ride, they would have to follow the restrictions on the ride itself. So I saw that question come in and I was trying to ponder it while Ron was doing his presentation. So
Fantastic. Did you see the next one from Harry? It's a bit of a longer one. So I'll read it out loud just so in case people don't have their chat box open. He asked, going back to the calculation question, we've had a challenge with our local health unit regarding what area is classed as accessible to the public. So they're taking a very narrow definition. They have a cattle show and they have to exclude the area occupied by cattle tie-ups, the show ring and spaces between the barns, even though at an event, they're showing cattle and it likely will be more people in the cattle tie-ups than in the aisles of the barns. So if we apply the same logic to the entire fair, we're going to spend a lot of time measuring all the small spaces that aren't accessible to the public. Harry had understood the calculation could be applied to the area within the paid fence minus major areas such as the pulling track, and not getting down to the level of subtracting, small electrical rooms. For him, on a 30-acre site with 8 buildings, that's a lot of spaces that will have to be measured and ultimately be rounding error on the calculation. So all of that information to say, is the health unit correct in that assumption?
Yeah, and again, I think that's where people will need to work with the individual health units. And it's kind of answering a question I saw from Harry near the end as well about the health units are the ones that will have kind of that local authority. And I'm not in a position to give a real entirely great answer to that question, other than you will need to work with the health unit, I think, on working through that.
All right. And I think I know the question you're referring to, so I'm going to jump to that quickly. Is there anyone higher up than your local health unit, if you think they're not following the rules as interpreted, that you can reach out to, or are they the highest power?
Yeah, and I don't know, Ron, if you've got any better interpretation of that than I do, but I'll phone a friend on this one if possible.
Yeah, I think what you need to be cautious of is you need to know who your local public health unit is, because the public health units are autonomous, right? So don't assume that the last public health region that you were in, that if you follow those same rules, you're going to be good with this public health unit, because they can have different rules, right? They have the ability to write their own rules in their particular area. So they could say in this region, okay, the interpretation or the written word on this calculation is this, but here's what we're going to do in our region. And they could create a tighter restriction in their region, for example, if they choose, right? Because they have that power to do that. So you have to work with your local public health unit to make sure that you're not crossing any local rules, because you could, especially if you're running a fair that's traveling from one region to another region to another region, the rules could change drastically. In theory, I think in reality they don't change that much, but they could. For example, on the temporary foreign agriculture workers, we had one region saying that the public health unit saying you can't have more than 3 workers in a building. Right? That was one region of the entire province that did that, but they did that. So you just need to be
Sorry,
cognizant.
Ron, I'm going to speak in here. This is Vince talking, and this has been my biggest challenge with everything with public health is the inconsistencies with the interpretations of these regulations or interpretation of these rules.
Yeah.
We have over 200 agricultural societies. In some cases, we have 15 agricultural societies that's ruled under 3 different jurisdictions within a district, and it makes it extremely challenging. And I sympathize with Harry here, the challenges that he is going through with this. What was interpreted before isn't even considered today, and this interpretation of space in a huge building with livestock, what is, what isn't acceptable to people or to the public is just not making any sense here. And this is where it's so frustrating for us as agricultural societies and volunteers to try and put one foot ahead of the other without taking 3 steps back when someone doesn't see it the same way. And it's tough because we just don't get a clear, well, first of all, I don't think they understand it, and everyone's interpreting it differently. As I stated before with someone, there's 35 health units in the province of Ontario, plus or minus, and there's multiple interpretations within, and that is real challenging.
Yeah.
Really challenging. So I hope that message can go back somewhere that gets rectified prior to us hearing what these announcements in step 3 and beyond are, because this is really tying our hands.
Yeah, and I think it's, like, just speaking from my own ministry, like we part of my role as a senior manager is ensuring consistency across the province, but we're enforcing the act and the reg, and it's pretty stable documents. I think the whole reason for public health having this autonomous by region is it allows them to react to individual flare-ups in particular regions. I think that's why that is there. But that said, they're not running around like the Wild West. There are we are in regular communication with public health in the various regions, and there are efforts on their part to try and ensure consistency, but they do have that ability to go above and beyond in a particular region if need be.
Well, and I think to add to your point, George just piped up and said, one metric the health units are using is the medical facilities available in the community in case there's an outbreak, because that's very different in every community. So not to be, I understand and I sympathize too with everyone's frustrations. It makes it really hard to figure things out, and it's really discouraging, but there's a lot behind the scenes too, right?
Yeah.
All right.
Ron, I appreciate your presentation. I think one point that I'd like to share is that the majority of our agricultural societies are volunteer-based. We have very few workers within. So some of the information doesn't necessarily pertain. I mean, where do you separate that off from the amusement contractors that have provided their own staff or employees for that versus our volunteers? And the huge majority of our agricultural societies are volunteer driven and operated. So
absolutely.
All right, we have a couple other questions, and this one was mostly answered in the chat, but I'm going to flag it in case, again, people don't see the chat. Michelle had asked if volunteers are not considered to be employees or workers, would they then need to be included in the 25% capacity? And Ron, you can correct me, but people were saying that they are not included in that. Oh, sorry, Tim. They're not included in that 25% capacity, and neither are entertainers or anyone, offering services while you're there. Is that correct?
Yeah. So like a lot of this legislation has been, gone through different iterations as we've gone through the pandemic. So, one of the issues we raised early on, and again, part of that is, trying to be consistent across the province, is that, they had written some limitations earlier on, not in this current version, but they were talking to, this is when the big box stores were open, right? Mm-hmm. And they were talking about number of persons, right? So we're like, well, okay, hold on now, like, because persons to us means everybody. So if you're going to say 25% capacity on persons, then that includes the workers, right? Which, for example, in a Costco, 25%, if you're counting all the workers in there, that doesn't leave you a lot of customers, right? So you got to look at the wording, right? So if it's public, that they're talking about the public being there, then I wouldn't be counting your volunteers as public, because they're not. They're there as, they're not workers, but they're not public. They're serving, they're helping to carry out this fair, right? They're participating. They're assigned responsibilities. They're not the public.
Perfect. Okay. The other question that came up was Harry had thought that amusement parks were exempt from the seated shows, and Tim, you flagged that the regulations actually state that it's the same and it's consistent, right?
Yeah, that's I've looked through I guess both the regulations and the public health guidance document that's also on the website, and it seems pretty consistent to me that anywhere there's a seated outdoor event, there's a reservation required. So
perfect. All right. We had Catherine asking, what happens should an employee exercise their right not to be vaccinated and yet continues to come to work, putting coworkers at risk? So at lunch and break periods when they're unmasked.
So, I could say from the Act and the reg perspective, there's nothing in there that would compel a person to get vaccinated, right? So the employer should have their own health and safety policy and program in place, including screening workers for signs and symptoms and going through that. There's nothing in the Act that would force a person to either get a vaccine or force a person not to work if they didn't get a vaccine. It has no bearing on the work that we do. Now, there are certain regulated professions where they're mandating that they have to be vaccinated. For example, I believe in healthcare, I don't cover healthcare, I'm industrial, but there are certain requirements there for vaccines. But yeah, there's nothing in our legislation in general that would force them to be vaccinated. It's a choice.
Yeah, fair enough. All right, I had one come in privately that mentioned the Art Gallery of Ontario has announced they're planning to open on July 21st inside under Step 3 regulations. So this person was just wondering, where did they hear that Step 3 was going to start on July 21st?
Well, good question. I think, as I said at the beginning, what's been announced through the roadmap to reopen is that we would spend approximately 21 days within each one of the steps. And if you look at when the majority, again, with the exception of at least one public health unit, entered Step 2 of the regulations on June 30th, then 21 days from that would be July 21st. So that's about as much as I can offer on that. But
fair enough. So they don't have any insider news. They're just hoping for the best, probably.
Thing is too, like even if let's say it happens on that date, what actually happens on that date, until it happens, you don't know. Things can change, details can change of what that step means. We're in the same boat a lot of times when these things are announced. We're like, okay, now I got to read through another piece of legislation to figure out where exactly everything lies here and what it actually says and what the wording is. But yeah, everyone's, COVID fatigue. People are, businesses are suffering. They want to get back up, and any edge they can get to let people know that they're going to be reopening, even if it gets pushed back, at least customers are lining up and getting ready, right? They got to get people through the doors eventually.
Yeah, exactly. All right. Liz asked, do you have any insight to beer gardens with special occasion permits with limits and seating?
Yeah, and I think for that, I'd point to the sort of the restaurant section, which governs capacities and table distances and pieces like that, is where I would advise to take a hard look and on a beer garden, which is likely seated.
All right. And Norma asked, are we allowed to ask a person attending an event if they're vaccinated or not?
I'll defer to Ron, but I think the short answer to that would be no. I don't see anything in any regulation that allows somebody to ask if you're vaccinated or not.
No, why would you ask them for any other medical information, right? Like that's, like I understand the tensions are high and people are worried about things, but that's private medical information, right? And so, again, back to my own legislation, there's nothing that would compel someone to tell you that. And secondly, I think if you were to get some legal counsel, they would strongly advise you not to.
And I think the other thing I would add into that is, and Ron, I think you're probably giving this advice to some workplaces as well, is that vaccination while it is extremely effective, is not necessarily the panacea or a replacement for other protocols and procedures on public health measures like distancing and whatnot. So.
Alrighty. And then I have Liz who asked, does seating in grandstands have to be numbered? So row 3, seat 2, etc.
I haven't seen anything that would require that. Again, within whatever the capacity of that seated event is, it's 25% of that, and reservations required. So I think there would be some, you'd have some ability to determine how you maintain that.
All right. Okay. Sorry, I was just thinking through that from the perspective, because when the bleachers, they're just benches, right? So how do you make sure people are keeping their distance and all that good stuff? So while it's not required in the regulations, it might be a good idea to have seats so people know where to go.
Probably something to consider in the safety plan to work up.
Mm-hmm. All right. Okay, well, I have one more question, but final call for questions in the chat box. We had some good conversation going on in there too. So thanks everyone for that. Sorry, go ahead.
Well, I was just going to say, I think I just was looking through a couple of the questions that Vince had shared that came in earlier, and one that I saw a few times is indoor versus outdoor space, and there are some pieces within there about tents, if they're fully open on two sides, or one side with a roof constituting outdoor space. So certainly that is on the website, because it was a question that came up a couple of times.
Great. Were there any others that weren't addressed in the presentation that came up before?
Just was looking through, and I think there was a bit on indoor, and yeah, certainly at this point, outdoor is in step 2. We've heard, or I think on the website, it talks about potentially more indoor events in step 3, but we don't know any details on that until, as Ron said, we get to read them at pretty much the same time as everybody else. But and I think a lot of the other ones were answered, and if not, hopefully somebody types it in.
Great. Well, and I did have one other question come in. This might be a little bit for Vince, but a little bit for everyone, I guess. Will this same kind of informational meeting be called to inform people about stage 3?
We are certainly hoping, and that was a conversation that we had earlier this week. So we'll be working with our team here to provide that, and definitely hoping that we have some more direct answers as to what this step 3 is going to be. And I was just going to say to Christina and Tim and Ron and Rick and Christine that our biggest concern is agricultural societies. It takes us time to plan our events. It takes a considerable amount of time. And when we don't know the uncertainties of what step 3 is, and it's like less than 3 weeks away now, and where that's going isn't giving us any kind of time to do this planning. So if there's any vehicle of able to communicate that back with our upper echelon, I'd greatly appreciate that, because it is extremely frustrating, and I've had agricultural societies cancel this week just because of the uncertainties of this, with the hope that we're going to, but it makes it really, really difficult here. And I really fail to think that they don't know what that is already and why they're not sharing it with us, even though it's not in place. So I struggle with that kind of thinking here. It's not very forward thinking for our volunteers in our agricultural industry here.
Yeah, and Vince, I absolutely understand. And I think when we had our smaller meeting there, however many weeks ago that was, you did a great job at pushing that forward. And I would say that it's heard. And certainly, I think to one of Ron's points a little bit earlier, the pandemic is a fluid thing. So there is, on one hand, you could plan it all out and then have to scrap things, which also creates a whole level of uncertainty and even more frustration. So it's definitely something we hear, and I think that has been communicated by a number of different folks who are trying to plan, but I'm not sure there's a perfect answer for it, I guess, is the long story short. But
Yeah,
I hear that.
We've heard it loud and clear from every sector pretty much throughout the pandemic as each of these steps potentially arrives or doesn't arrive or gets pushed back. It's it's common messaging. Like, just tell us what it's going to be so we can prepare. Like, it seems like people would be open to, okay, we were going to open on this date, but okay, we're going to push it a week. But at least when it gets there what it's going to be, right? And it's a frustration that's been heard loud and clear.
Well, I mean, some of this has been based on, and I know you aren't the folks that I need to be shooting this off to, but I mean, some of the language around this was X number of vaccinations for first shots, X number around second shots. Yeah. And we've more than surpassed that from the information I've been provided here. So we need to be providing our people with more information here for some more definite forward thinking and forward planning for everyone here. We're not doing it for ourselves. We're doing it for the people that need to get out and socialize and get back to normal again here.
Absolutely.
So. And you know what, there's a couple of people echoing those comments in the chat box that, if we could know, it would be really helpful. And, the planning runway is shrinking. So that duly noted. I think we did have a couple other questions pop up. Tim, thanks for putting the link in there for those parameters that people were asking about.
Sorry, and the first two, if people have the agenda, the first two I think are links in the agenda, but if you go to just the webpage of ontario.ca/COVID, partway down, you will get to a roadmap reopen at a glance, and then that other public health page and the regulations will link off of those pages. So,
Perfect. All right, Liz had just made a comment that the Stampede at Calgary is requiring proof of vaccination to attend a concert. Just as a little point of clarification, it's to attend their Nashville North tent, which is, they have performances there. It's kind of like a beer tent. And it's either proof of vaccine or they have rapid testing available. We'll see how that all rolls out. Bev asked, if you are having an event inside the bigger event space, does it have to be fenced off in any way?
That's a good question.
Go ahead, Tim.
Yeah, thanks, Ron. Yeah, like I think an event within an event would have to have some boundaries, whether it's a hard fence or some other delineation. But I guess my reading of the regs, I'm not sure that I have a perfect answer for that question either.
So work with your local health authority?
I think so, yeah.
Yeah. All right. And Chelsea asked, they're looking into figuring out how many washrooms are required for the number of people. There doesn't really seem to be a set formula. Can anyone offer insight on that?
I'm not sure it's going to be well beyond my expertise on sort of the COVID side. I don't know if there's other public health guidelines that dictate the number of washrooms available for the public, but that's well beyond me. I'm going to indicate.
I can tell you what I was told from my public health. Contact your building inspector. So again, so many mixed reactions out there, and I know I've been asked many times to try and have someone from public health speak, but it's it's what might be working in your area, Tim, definitely isn't going to be working in Harley's area or Randy's area at North Bay. Like, it's just such a variation here.
I wonder if it would be worthwhile with the washrooms to also reach out to your local, whoever supplies your sanitary measures, the porta potties and stuff. They might have better insight into the regulations as well, because they live it 365 days a year. Food for thought. Okay, so those are all the questions I've received. I think I'm going to toss it back to you, Vince. Thank you so much for having me and for listening to me ask questions.
Well, thank you, Christina. And as always, we appreciate you capturing everything and summarizing the questions so graciously together for everyone. I want to thank Tim and Ron and Rick and Christine that we've worked with over the last few weeks doing this.
And Rosanna, we're not going to let Rosanna out either. So
definitely not. But she didn't show her picture here tonight. And then Rick was there as Rosanna at one time. But yes, Rosanna, thank you very much. for all your work and patience with me in this. And I think I can say, there you are. Thank you, Rosanna. People have been asking who Rosanna is. There's Rosanna. I fully intend that we will have a meeting here before the end of July. Twofold. One is because I paid for a monthly fee to bump up our Zoom account that cost us nearly $100 to put it up over the 100. So let's have that meeting before the 1st of August there. So let's put that in our calendar. I'm hoping maybe the last Wednesday in July might be a date that will work. Wednesday seems to work, but saying all that, thank you folks. And I want to turn this over just for a moment here to our current president, Beth Howell-Vervac, for a few words on representing the OAS.
Evening, folks, and again, thank you to our presenters tonight, and thank you to all of you who participated this evening. This is your chance to have your voices heard, and I know the people that are presenting have heard you. We're just hoping that being able to present this is going to be something that we can help move us forward with our ag societies. It is something that as a united voice, we are stronger, and it is something that we are wanting to make sure that we are showing good faith, that we are sharing this information as much as possible. And thanks to our presenters for being as forthright about what they're available to share with us as they have been able to. And we look forward to hearing what happens for stage 3. Have a good evening, everyone.
Thank you, Beth. And again, and just following up, I want to thank each of you that took the time to send in your questions ahead of time. It's greatly appreciated, typing them in the chat. And I know some of you are going to say we didn't get them answered, but we hope we will be able to answer them in our next round in more clarity and give us the information and the tools that we need to be able to drive forward with some events here in the upcoming months. So having said all that, thank you very much. Go Canadians.
Go Habs, go. Night, everyone.
Thanks, Vince.
Good night, everyone.
Good night.